Hi, my name is Dr. Ken Anderson, and I'm here at the Anderson Center for Hair, and today I'm answering some of your frequently asked questions. Today's question is from Ryan, and he wants to know, how long after his hair transplant surgery can he exercise and golf? Great question. We get this one a lot. It's kind of a two-part answer. For light exercise, it's 7 days, and for really strenuous exercise, it's 14 days. So for things like golfing when it's not too hot out, going for a walk after dinner, some light exercise like that, you can start doing that at about 7 days. For really effusive exercise, you're going to go on that elliptical and tear it up, or you're going to go for a strenuous run, or if it's really hot outside and you want to go golfing, that's going to involve a lot more sweating, which is a very effusive process. We kind of want all the wounds to be healed up completely before you do that. What are the follow-ups necessary after a hair transplant surgery? After a hair transplant surgery, I'd like to see patients back at 2 weeks if they've had an FUT linear surgery. This, of course, is to remove the stitches. If you've had an FUE surgery, of course, there are no stitches to remove. Sometimes when patients are traveling on a plane or from out of state on a long drive, they'll stop by the clinic the very next morning for just to have us have a look at things and get them rewrapped for their trip back home. So sometimes patients can opt to come back the very next day. But 2 weeks for suture removal, and then really I don't need to see patients again until fully 1 year later. It takes 1 year for the hair to fully grow in. I think we're going to be giving you a call in about 3 months or so, and of course all patients are welcome to come back and see me, whether virtually or in person, to have me check on things. But at a year, we'd like to see all patients just to make sure you're happy, to have a look at the results, and to just talk about further hair loss prevention. How long after my hair transplant surgery can I go scuba diving? And we get questions like that a lot about scuba diving, swimming, wearing a snowboard helmet. A lot of people like to take some time off and go on a little vacation after their procedure. The short answer is 2 weeks. And the reason for that is we want all the follicles to be well anchored and fully healed in, and we want the wounds all to be healed, whether that's from a linear strip FUT, where we're going to have some stitches removed at about day 14, or with an FUE procedure where there are no stitches, but the wounds will be fully healed by 2 weeks. So whether it's wearing a construction helmet, a motorcycle helmet, scuba gear, swimming, getting into the lake or the pool, we want you to wait about 2 weeks. If I shave my head, how long does it take for the hair to grow back? Well, really, this question is about how fast does scalp hair grow? And the short answer is about 1/2 inch per month on average. Some may grow a little quicker, some a little slower, but roughly 6 inches per year is the rate that's generally quoted. So if you're planning on trimming down your hair and want to know how long it's going to take to get back to its current length, plan on 1/2 inch a month. If I'm having an FUE procedure, do I shave down my head or do you guys do it for me? The short answer is let us do the work. A lot of people are aware that, especially for larger FUE procedures, some of the donor area has to be trimmed down. But it has to be trimmed down to a very specific length, and that is 1.0 to 1.2 millimeters. And we've got special trimmers just for that. You don't want to do it yourself. Believe it or not, once in 2004, before a big FUE case, someone came in and they shaved their head with a razor. There was no, it was just right down to the scalp. And we had to postpone that case because I need a little bit of the length of the hair shaft to help me determine the angle at which to remove that hair from the scalp. So don't do anything. When you come in, we're even going to shampoo your hair with a special surgical shampoo. So let us do the work and don't shave your head before an FUE procedure. Plus, you might shave too much. We try to minimize the amount that has to be trimmed down. How long after the hair transplant surgery can I wear a hat? Great question. This kind of depends on the areas that are treated. Typically, all of the follicles that are planted are going to be sort of on top of the head or under where a typical, like, say, baseball cap would fit. And so patients can actually wear a baseball cap the next day. We don't want any tight-fitting hats or hats that where the material sits right on the scalp, but a baseball cap that kind of where the part above the head doesn't really touch the scalp, that's fine. The one exception would be if we're doing reconstruction of the temporal points, which are the little tufts of hair right in front of the ear on the side of the head. If we've done reconstruction work there, you'd want to wait at least a week before wearing a baseball cap. But that's not typically the case. So if we're just doing a transplant up on top, you can wear one the next day. Your head will be a bit swollen, so you'll kind of want to loosen up that cap before you put it on, and kind of put it on carefully so you're not dragging it across the freshly implanted follicles. I've read about having to sleep in a reclined or upright position after the surgery. For how long do I need to do this? I would like patients to sleep in a reclined position. If you have a recliner, that would be great, for 3 nights after the surgery. We do provide one of those inflatable neck pillows like you see a lot of people using on airline flight, or you might even use one yourself to help sleep and support your neck. This keeps you from rolling around and touching your follicles in a few days after the procedure. It also helps to speed away any swelling, keeping the head above the level of the heart in a vertical gravitational sense for as continuously as possible after the procedure for 3 days really helps to speed away any of the swelling that occurs and is most noticeable sometimes in the eyes and face after a procedure. One of the questions I get a lot is, how do I shower after a hair transplant procedure? The main thing is that we don't want the shower jets directly hitting the transplanted area where the follicles were placed for a good 5 days after the procedure. During this time, you're going to take a plastic cup into the shower with you. You're going to fill it up with some baby shampoo and make a slurry of water and just pour this water onto the treated area on your scalp where the follicles were placed, but you're not going to actually physically touch the new follicles or your scalp, and you're not going to let the shower jets hit them directly until day number 6 after the procedure. Again, all the instructions will be provided, but that's the short answer. How long after a hair transplant procedure can I dye my hair? The short answer is I would wait about 3 weeks after a hair transplant surgery to dye your hair. And the reason is because we want all the wounds, whether it's from the stitches in the back or the recipient area, follicles where they're placed, we want everything to be nicely healed up and the skin to be completely intact before the dyes are applied to the hair and the scalp. Is a hair transplant surgery painful? Great question. That's actually a primary concern of a lot of patients. Well, I'm here to say that no, most patients do not consider it a painful ordeal. Many patients comment that it really is less intense and less painful than having your teeth cleaned at the dental hygienist. I mean, this is elective medicine, and to be truthful, pain is bad for business. And so we go out of our way to make sure it's not a painful experience during the procedure. When you leave after the procedure, patients tell us that where the follicles are placed in the treated area, it's numb. It doesn't hurt at all. In the back, in the donor area, if they've had a linear FUT procedure where there are stitches there, feels a bit like a mild bruise. If they've had an FUE procedure where follicles are extracted individually and there is no linear scar, it feels a bit like a sunburn. But it's a mild pain. Most patients will take a single pill of the narcotic medication on the evening after the procedure and then don't take any more narcotic medication for the duration of their healing process.